Welcome to the Chiropractic and Legal Injury Podcast, recorded live at our events. We're here bringing you the expertise, insights, and tools you need to navigate the world of personal injury care and to uncover what you didn't know about car accidents. It's no accident you're listening today, so let's get started.
Hi, my name is Larry Lazzara. I'm the managing attorney of the Lazzara Law Firm, and we are joined today with the legendary neurologist, Dr. Shayya, who specializes in traumatic brain injuries, concussions following motor vehicle accidents. So, Dr. Shayya, welcome to the show.
Thank you.
Now, tell us a little bit about what it is that you do as a neurologist.
So as a neurologist, I am trained to diagnose and treat neurologic conditions. So anything that occurs from the brain to the spinal cord to the nerves that go throughout your body, even into the muscles of your limbs, any sort of numbness, tingling, weakness, looking at seizures. So anything that occurs throughout the whole nervous system is what I was trained to diagnose and treat.
Wonderful. What made you go into neurology?
So when I was looking to decide what kind of physician I wanted to be, I looked at the different systems, and the one that I found the most fascinating was the nervous system. The brain, how it works, how it controls everything, how it doesn't work and how it has issues, and then how I can treat it to make things better.
That's wonderful. Well, as a personal injury attorney, most of my clients are in motor vehicle accidents, and a lot of them sustain concussions. Do you treat concussions?
Yes, so concussions are another name for what we call a traumatic brain injury. So I've done expert training I'm board certified in brain injury medicine. So I'm able to both diagnose concussion or mild traumatic brain injury and then also treat it.
Wonderful. So if you were to work with the chiropractors, which I heard you do in the personal injury world.
Yes.
And what percentage of your practice would you say is dedicated to personal injury cases like the ones that I handle?
So I have a full practice, so I see all patients for all different kinds of neurologic conditions. In terms of figuring out how much I'm seeing from a traumatic brain injury perspective, I would say maybe 20-25%, and then the rest are my other patients that I'm seeing for things like Parkinson's, neuropathy, dementia, stroke, seizures, all the other neurologic conditions.
So that's a wide array of conditions. That's amazing.
Thank you.
So if you were to talk to chiropractors and the general public about symptoms and identifying concussions following a motor vehicle accident, what advice would you provide them on what to look out for and when to come and see you?
Sure. So in my experience, the chiropractors are kind of the first line clinicians that are interacting with these patients. Often these people who have been in motor vehicle accidents, they don't know where to go. They're in a car accident. They're trying to figure out, I'm hurt. I need someone to see. And often with their regular health insurance, they aren't able to find that kind of care. So they end up going to chiropractors who have kind of been the specialists for these things. And then when they see them, the job of the chiropractor is to identify, okay, what's injured, and then where's my team? Who am I going to get involved here to kind of help with? So the symptoms that you look for a concussion, which occurs depends on what study you're looking at, but anywhere between 50 to 80% of patients who are in a motor vehicle accident will have some sort of neck and whiplash kind of injury, which can also shake the brain, causing the concussion symptoms. So the symptoms that you'll be looking for, number one, is headache. That's probably the most common that people definitely see. Then you have the dizziness, and then it can affect all kinds of things with like sleep, mood, other sort of neurologic symptoms, numbness, tingling. That can occur also if you've had some more severe type of brain injury.
Now, what happens if a patient presents and they have some of those symptoms but not all of them? Is that still considered a traumatic brain injury?
Yeah, it depends. So when you're looking at the diagnosis of traumatic brain injury, each one is unique. I think of it back in college days, there was intramural and intramural kind of events, and that's kind of like sports type of things, and that's how I try to remember it when I think of what happens with a concussion. There's intra-reliability differences and intervariability and intervariability. So what does that mean? That means that each person can have if they've had a concussion, is different between person to person. And then in the same person, if you have them hit their head, their concussion can be different from one to the other. And you hear this all the time. I had a concussion 10 years ago, and a couple of days later, it was fine. But then this one is lasting days, hours. Like, I'm just going on and on. What is the difference? It's that this injury was different. And so therefore, when I'm talking with patients about that, I'm letting them know, okay, this is the change in that, and that there are treatments for it.
Sure. Well, my understanding is most concussion symptoms resolve in under a year. Is that right?
So most concussion symptoms by far will resolve within a month, actually.
Wow.
That's like, we know that for about 80% or so. What I end up seeing in my clinic is usually that 20%, because people have ongoing persistent symptoms. And the idea, we used to think, oh, then that should just go away within a year. But that's not the case. Unless you treat it, the symptoms can go on for years until there's actually been some treatment, because the brain is kind of stuck. It's bruised, it's not healing right, and then you need to go see the neurologist.
I've seen the names concussion and post-concussion syndrome used quite a bit in your medical documentation. Could you explain the difference for us?
Sure. So concussion, depending on the symptoms, as you were mentioning before, like there are symptoms that can occur with concussion, and you don't have to have all of them, right? You just have to have certain ones, and if you have enough, you can meet the criteria for concussion. And to meet criteria for concussion, as I mentioned before, so I like to use the term mild traumatic brain injury, because that's accurately what it is. And if you have a mild traumatic brain injury and it has certain features, you can call it a concussion, because that's what most people know it as. Okay. I use the term post-concussive syndrome. That's the ongoing symptoms, that 20% that I was talking about.
Right.
That's their diagnosis, because their symptoms are going on longer than the acute concussion phase, which is, like I said, about a month.
So would you say that those are the chronic cases that you have that would meet the criteria for post-concussion syndrome?
Correct. So my first step is to identify, did they have a concussion, yes or no? Was the brain injured? And then, where are they? Are they an acute concussion? Are they post-concussive? How aggressive do we need to start with treatment? Do we wait and see? That's the decision making I'm doing.
So somebody presents to your clinic and they are diagnosed with a concussion. What types of treatment does your office provide for your patients who have sustained concussions?
No. So in my office, when I'm evaluating the patient, I'm trying to identify what their other symptoms are. And I'm very conscientious of the fact that, I can't do everything. So I have a team, right? And that team includes the referring chiropractor. If I need to send out to like a surgical specialist sometimes, if there's something even more serious that's going on, if there's pain management, all these things, I have to consider those things when I see the patient. But what I can do in my office is treating the symptoms that they're having. So often headache is the most common symptom of a concussion, and that's something that I treat regularly, just headache patients. So I treat their headaches. Sometimes we do things like medications. Sometimes we can do some injections for headache. And then if they have sleep issues, that's a big common one, so I can use some medications for that as well. If they're dizzy, I'm having them return either to the chiropractor. Sometimes if they need to go see a physical therapist, depending on the expertise in terms of the vestibular system, I'll have them do that. And those are the kind of symptoms that I'm treating or referring out.
Excellent. If somebody presents to your clinic and they did sustain a traumatic brain injury from, say, a car accident, and they're not represented by an attorney, what advice would you give that person when talking about the issues of dealing with the insurance companies and how to move forward best with the case?
Well, that's easy. Go get an attorney.
Yeah.
Usually you. So
I appreciate that. But what is it about an attorney? What is the attorney, in your opinion, how do they contribute to the case?
Right. So when I've spoken to patients about this who are, I think the term is unrepresented when they come and see me, I'm telling them, what's going on, how are you dealing with it, and there's a lot of stress going on. One, you're injured. Two, often your vehicle, if it's usually severely damaged, so you don't have a car. You're trying to get around. You have to try and live your life. And on top of it, you're calling to try and be put on hold with an insurance company trying to get stuff done, and you don't know what's going on. It's a whole different world that, as a patient, you have no idea how to navigate it. You've never needed to interact with it, and now it's really messing with your life now. So I think the role for the attorney is their expertise in how to guide the patient through the system, because as you know that from A to Z, how to get them through the whole process and take that pressure off of them. And when I've spoken to them, there's some misconceptions of, hey, what is the attorney going to do? And what I explain to them is, look, the attorney is going to do all the stuff that you're paying them to do, which is take care of all this. And then your job is simply to get better and to get back with your life.
Spoken like somebody that's been around and done it a few times, huh?
Yeah.
Let's talk about litigation. So let's say a case does not settle or a patient doesn't get a settlement offer that they're happy with, and the attorney goes ahead and files a lawsuit, and you're the provider on the case. Do you ever get your depositions taken? Do you ever testify in court? Can you tell us a little bit about that and maybe share your favorite success story on a case that went to litigation?
Okay. So I have done that, and I actually do that with a pretty regularity. So in addition to seeing patients who are injured in motor vehicle accidents and then seeing patients for other neurologic conditions, I also treat injured workers. So with injured workers, often, probably at least once a month, I'm going before a judge and having to give my opinion on terms of what has happened and if this patient needs to have ongoing care under the workman's comp claim. So that experience has helped me quite a bit, be very comfortable. I've done multiple depositions if I needed to for these types of like personal injury cases. I've been to trial once to litigate and give my opinion, and that was as a treating physician. So I went and represented, my patient and said, look, this person was really badly injured. We need to get them the care they deserve. And fortunately, in that case, my opinion was rendered to be factual and accurate, and that was helpful for the case.
That's amazing. Excellent. Well, as a personal injury attorney who's had the pleasure of working with you over the years, I have to sincerely thank you for all the work you and your staff have done. It's been an absolute pleasure working with your team. And I think one of the big bonuses of working with your office is your ability to get patients scheduled very quickly. So if a chiropractor is looking to refer to a neurologist and there's concern about delays in getting people seen, oftentimes, as you know, it takes 3 months, 5 months sometimes to get in to see a specialist. But what makes your office different? What makes it so special?
So I think our focus on my office, and again, you're correct, this is the team that I have. I'm very fortunate. I have a great team at Neurology Consultants of Arizona, and we work very hard to get patients in quickly and get them treated and then get them back to their clinicians. So that's kind of the model that we have, is that we are the consultants. So patients come in, they get the treatment they need, and then we return them back to their referring doctors. Because of that model, and because I have such a good team, including myself as well as a few advanced practitioners that are in my office, we're able to work collaboratively, and as a result, I'm able to get patients seen within 1 or 2 weeks, especially if they've had a trauma. Because those patients, because the symptoms they're having, they're so acute, we've kind of helped prioritize them to get in there and get treated. And then that's, again, mentioned earlier, the wait line for my colleagues is anywhere between 3 to 6 months. So my goal is to try and get patients in quickly, get them treated, and then get them back home.
So I just want to make sure I heard that right. Your colleagues, it takes 3 to 6 months to get in to be seen by them, and for your office, it's 1 to 2 weeks.
Correct.
That's an incredible statistic. How would a chiropractor, for example, go about referring you a case?
So the easiest way to do that is we have our phone number you can call to schedule an appointment, and I have a dedicated med legal team. And I can get you that information in terms of there's an email address, phone number. You can call the main number, and then you'll get routed to the medical legal department because I've hired some special people to deal with this.
Excellent.
Like you had said earlier, it's a whole different world, right? Like that's where your job comes in, because people who are injured in injury, it's different than using like health insurance. You're using other claims, things of that nature, whole different world. So they help navigate that because that's what they do. And because they've been trained and do that well, we kind of get them in the right department, and that helps the patient. Because if you're calling and you're dealing with someone who doesn't have the experience, it's just going to slow things down.
Sure,
and
that's
then ultimately, I think the patient suffers. So going to someone who has experience seeing hundreds, not thousands of TBI patients, like as I have, is a big difference than trying to find just someone you can on the street.
Well, Dr. Shayya, it's been such a pleasure working with you and your team, and the personal injury world is better because you're in it. And so thank you for everything you and your team does, and let's keep doing it into the future. And again, thank you for coming onto the show, and we really appreciate all the work that you do. So thank you for helping our clients, and thank you for being a champion in the neurology world, and we look forward to having you come back and present in future seminars.
You're welcome, Larry. Thank you.
All right, take care. Thank you.
From all of us at the Lazzara Law Firm and the Chiropractic and Legal Injury Conference, thank you for listening. We hope you never need us, but if you or someone you love does, know they'll have a team dedicated to helping them rebuild, recover, and reconnect with what matters most, their loved ones and the life they deserve. This is the Chiropractic and Legal Injury Podcast, where knowledge is power and collaboration transforms care. If today's episode opened your eyes, share this podcast with your network and help spread the word about the realities of personal injury care. Follow us on social media to keep learning and connecting with this incredible community.